Everybody thinks backdoor play is dirty. There's so much poop in that space. You're going to contaminate me and be dirty and kind of go from there. Culturally, you see it with so many different facets of religion, culture aspects, locations as to what that all means. Obviously, there's a lot of internalized homophobia in all of that. The reality is, why do I lick people's armpits or nip? Or why are we going into so many different areas and cavities if it wasn't pleasurable? Why are there pleasure centers if it wasn't meant to be something that was an erogenous zone in that space?
I want to start out with your 30-second origin story. What pulled you into the world of gay men's intimate health? And was there a moment when you realized this is where I'm meant to be and the work I'm meant to do?
Yeah, so I started with cardiac surgery. I was miserable at that time. I was married. I wasn't out. I finally came out. I realized that I didn't want to do heart surgery, and I started to kind of be gay and experience all gay things, even myself with my partner. And you start to ask questions of, wait a second, this can't really happen so easily in terms of backdoor play. And how do you progress through it? Or what happens if you get injured? And I started to kind of really look into the space to say who in the community is doing this much needed work. And I realized that nobody was doing it, and nobody was doing it the way that I wanted it to be done. So that was really the birth of Bespoke Surgical, which was to say, how do we find a place that we can destigmatize, get rid of the taboo on all subjects, provide that safe space, but also provide corrective surgeries, provide aesthetic approaches, provide education, and all of these things that then has led us into even starting a brand called Future Method, which is products to support the community. And so it really kind of had a mind of its own. And I had always said, whether I fix the face, the boobs, the butt, as long as I got people where they wanted to be. And as you're doing that, you see that sex is so important, regardless of which types of sex that you're having. And by me giving people the gift of allowing them to engage the way that they want to is just such an amazing thing for me and the community.
Oh my gosh, I love that. And that really just leads me into my next question. What is the core mission that continues to drive your work and the message or insight that you love most sharing with the world?
I think it's the education piece. That was the reason I started with But Seriously, the book, was I felt as if, forget just gay men, anyone that has a butt, right? Anybody that has a hole. There's so many ways that we can stimulate and do what we need to. It doesn't have to be full penetration. Also, nobody teaches us the right way to poop or the right way to teach our kids to wipe and poop correctly and do all of these things. And so for me, it really was taking the myths out of it, dispelling these taboos, and really allowing people to kind of look at things in a different way to figure out how does it fit into their world. I always say we only have one sex life, and the reality is you need to experience everything. And if you don't experience it, you wouldn't know if you like it or not. And many people on the anal side just wind up not engaging because of society's pressures, the stigmas, lack of education. And it's really been cool to be on that forefront and work with you guys to really push all of these. And I think that that's the key, is now it's really me educating not only patients, but clinicians and practitioners and all of these people that are involved in the sexual health component to figure out how we push these narratives to educate people. Because if we're educating people, we prevent injury, we prevent all of the things that go with it to allow people their sex lives. It's pretty cool.
Yeah, absolutely. Education is just a ripple effect. Like you mentioned, you go on and educate these other professionals who then go on and educate their clients and other professionals. And it's just such a cool effect to see. Much of your work is about destigmatizing gay men's intimate health and creating affirming whole life care. So how do stigma, shame, or misinformation shape the way that gay men experience pleasure, desire, or connection?
It's always like, am I going to poop on somebody, or am I clean, or can I perform? Or there's so many things that go in. Also body dysmorphia and what we look like. And everybody on Instagram is like 6-pack abs or 8-pack abs and so beautiful, and like kind of understanding all of those intricacies. It's super complex. I don't think we have enough time to even go over all of these issues as it relates to it. But I think it's trying to first allow people to understand what type of whole they were given. I think that's really the main goal, is personal exploration into self first. We all start with, obviously, with our own master and our own understanding of that. But then it's also like, well, how do you know what type of cavity that you have? How do you know how it functions? How do you know how to use it? What are the right ways? And I always break things up to kind of before backdoor play, during, and after. And the concept of all of those things is allowing people to really understand, well, how do they perform? That's where dilation and understanding your anatomy and doing things on your own. How does your mental mindset work with it? So all of those things, because I get it. We all want to engage with others in theory. Some don't. It's a stepwise progression. People go from nothing to something big way too fast. And then that creates the trauma, or it creates pain. And people are like, I never want to do this again. And it's something that they would have loved if they would have just understood their own anatomy. So I think a lot of the class that we spoke of on the keynote was allowing people to really, even if you're not me with all the tools that I have in the office, how do you really understand what you have? And then how do we get you to where you want to go sexually? And that is super empowering. Through that, you can learn, okay, how does my body work? How are my bowel habits? What do I need to do to create a safe space or a clean space to what you define as clean? It shouldn't be what other people define as clean. And all of those stigmas that play into it, I think the first thing is to really start with your own self in anything, right? But then also the next phases of where you want to go.
I want to know, do you think there are myths out there that are really doing harm?
That can go very political very quickly, right? I mean, I think that everybody thinks backdoor play is dirty. There's so much poop in that space. You're going to contaminate me and be dirty and kind of go from there. Culturally, you see it with so many different facets of religion, culture aspects, locations, as to what that all means. Obviously, there's a lot of internalized homophobia in all of that. The reality is, why do I lick people's armpits or nipples? Or why are we going into so many different areas and cavities if it wasn't pleasurable? Why are there pleasure centers if it wasn't meant to be something that was an erogenous zone in that space? Over time, you see it. Nobody would talk about any of this stuff 15 years ago. Now it's very, very vogue and very, very forefront of how do we, talk about these subjects, because it's clickbait for a lot of different things. I think generationally, we're seeing more and more of all of these myths being dispelled. But I think it's really great of what you guys are doing and kind of a lot of the media of continuing to push normalcy, because by pushing normalcy, it translates to so many improved outcomes for all these biases and bullshit, basically.
Oh, yeah, absolutely. I just remember being a young sex active person, and if you liked anal sex, you're a whore.
Yeah,
And that was
totally.
like a common myth that I grew up with.
I think another one is like, oh, if you take it up the, you must be gay. Or if you take it up the, not only are you gay, you're more submissive. And all of that is completely bullshit. It's so funny because I even have preconceived notions when someone's walking through the door, just of how people look, how they act, and all these things. And you're constantly reminded that that means nothing. Perception of what you think and reality are usually completely off. And when it is off, you're like, wow, why am I so stigmatized myself, right? Why am I thinking one thing of somebody when the reality is that that means absolutely nothing? It's always so interesting when you hear all these stories of people and what your preconceived notions are to what reality is. Totally two different things.
Yes, exactly. It's like an ongoing work all the time. You wake up and challenge stigma every day. Now, if you could teach the world just one thing about intimate health that truly could change lives, what would that be?
I think it's what we just mentioned before, that you can't go from nothing to something big. People just think, especially, female skin is very, very thin in that space. Male pelvis has lots of muscle that restricts, and it just depends on what type of muscle you have. Many people just think like, oh, yes, just shove it in, or hey, it's just like vaginal engagement. No problem. Well, it doesn't lubricate. It doesn't open like the side, there's a muscle that restricts you, there's weak skin in that space. And so I want people to really understand anatomy, because I think if people understand anatomy and function, they would really figure everything else out. I think all the other stuff plays into that. If you don't understand the core concept of how engagement or backdoor play truly works, you won't get to those next levels. Even though it's so basic, I think none of it is basic in this world, because no education exists as it relates to on the grounds to truly get the people before their first engagement, because the goal is to make sure that that engagement is the best engagement possible, the most successful, because then I think that will translate to just longevity of sexual health and health.
Oh, such a good point. And I cannot even count how many times I've heard people say, oh my gosh, no, I hate anal. I could never do anal again. The first time I tried it was so awful.
Totally.
Never, ever, ever.
I think that that's a huge push from a campaign perspective, not only for bottoms. We speak a lot in the book. We do like top tips for people that don't necessarily want to engage anally. I think everybody should engage to see, one, how amazing it is and the pleasure center and understanding the right ways to engage. But realistically, I get it. But if you are understanding of anatomy and you understand that it's not lubricated and you understand how the muscles relax, even if you're not the one really getting penetrated, but giving, you can do it softer and do it the right way and do a lot of foreplay and pre-lubricate and set the stage for complete success, because it is so important.
I love it. Set the stage for complete success. What is one trend in intimate wellness that genuinely excites you?
I think the trend is that finally people are actually realizing that they need to pay attention and that they need to see physicians and they need to see people to get that really working, just like dermatological health, just like facial work that people are doing, skincare prevention and all these other components, gynecology convention, all of those things. Now I think the side is really making the forefront of how do we just understand all the things we spoke about, but also get it checked up, make sure we're doing all the right things, creating hygiene, because hygiene is so important, and understanding of that and being seen to make sure that people are doing what they want to do. No questions are bad questions, but if you don't know the right questions to ask or you don't see the right specialists, you're not really going to get what you really want. I think one of the things that I see a lot now on the aesthetic side is this device, which is super exciting, called Tempsure. It's a TEMP SURE, and Tempsure is basically radio frequency. It's non-ablative, but what it does is it heats the tissue in the anal space. It heats it, and it creates better collagen production. Many people come where their skin is really thin or they're trying to engage, and so what happens is they get these micro tears, and I used to have to take people to surgery and give them more room, but now we're really able to work with a device that strengthens the skin and the architecture, so that if someone gets behind you, if it's bigger than your normal, if you have a big poop or something that's stressing the area, that the skin is now tough so it can withstand the pressures, so people aren't having those issues. I think what's so cool is that all these things are happening, and there's new machines and new delivery devices and new ways to treat people to allow them the longevity.
Oh, I love that. Yeah, the more we explore, the more technology and advances we're going to have in this space. From your perspective, what practical steps can families, mentors, allies take to reduce shame and foster healthier, more affirming messages early on?
I think I'm going through it now with my kids. It's really having open dialogue and communications that no questions are off limits. I always tell people you don't need to know all the answers, but you need to know who does have the answers. It's a lot of understanding your child or yourself or all of your components as it relates to it. But then it's setting the stage for that, which is how do you have the right resources? And that's what's really great about what you guys are doing and the resources that people have to allow them to get access to the education. That was the impetus of But Seriously, the book. and to really just set that stage where there's open dialogue and there's open communication to now allow people to really, really get to the forefront of saying, okay, how do I feel comfortable talking about these subjects? How do I really feel comfortable to open the dialogue to a lot of people? I always say it's always so funny when I'm at dinner tables and with someone, people that I've never known, and the question comes in, well, what do you do? My partner's always like, oh shit, here we go.
Here we
Because the
go.
thing is that once you open the gates of what I do, everybody on that table has had issues, whether it's issues just that are limiting pooping in life, to, oh, hey, I didn't even know that existed, to, hey, I want to engage in and play and backdoor stuff and I can't, or I didn't. Someone's DMing me or saying like, hey, thank you so much for allowing us to have some of this conversation, because nobody feels comfortable doing it. It's having Shaw advocates that go out there to dinner parties and constantly talk about all of these things that then allows these conversations to just keep happening globally.
Oh, I love that so much. Absolutely. It's like the ripple effect all over again. I want to know, what's the ugly truth about doing this work? Is there a part of being a leader in intimate health that nobody talks about?
It's a lot of pressure. You know, I'm the only person in the world that does this type of work. It's 24 hours a day. It's 7 days a week. Of course, I'd love to train other people, but what are the odds to find someone that's either gay or queer friendly that wants to go into this stuff, that really believes in the missions and what we're doing? It's not easy. It's a lot of content and it's a lot of driving this and it's a lot of pushing and doing, and it just doesn't end, which is amazing. Sometimes I say I created this jail cell and I don't want people to think that I'm not grateful. Like, I have a great life because of this. I have two beautiful kids. We're able to experience so many amazing things. When you create something, you have to work it. You have to constantly be doing something. And then people get hurt at all hours of the day and all issues. And so it's a lot of, how do I maintain quality of life, but give other people a life, right? It's always this balance of trying to figure that part out. Sometimes I'm just kind of like, oh my God, what am I doing? Why am I doing this? It's just too much. But when you get an email from someone that they've never engaged with their partner and they're able to now, all of these things from people all over, and people are flying in from all over the world because of to access this type of care, and you're able to give them these solutions. I mean, you can't win. That's like amazing.
So, is there any part of your own health or wellness that still challenges you?
No, I don't want to go for a colonoscopy. I just don't want to drink that and take time to do that. So I got to do that. I'm going to be 50 to do that again. You know, in the book, I talk a lot about my own issues with sex, backdoor play. When I was in medical school, I had a pretty significant tear just from constipation that never healed correctly. And so I had surgeries. And then obviously I wasn't able to do surgery on my own hole. You had to kind of really coach and figure out. And then how do you get yourself into an space that you feel comfortable and can explore? And a lot of that is put in the book, but it's still always work in progress. So it's always challenging.
Yeah, absolutely. I want to know, if you lost everything tomorrow and had to rebuild your career in intimate health from the ground up, what would be your first three moves?
I think number one I would restart all my social media accounts, because that reaches the masses. Why I'm so relevant today, I think, is because of the social presence, the PR presence, and just going direct to consumer. That really has been a huge win for this timeline of sexual education and sexual health, right? Two, I think, is picking up the phone and calling you all and saying, okay, can I do keynote speakers again? Do you remember me? Can we rebuild? How do we kind of get the masses and go from there? And then I think it's really just community-based practice. It's how I started. I still believe in it. I support all of the clinics in the areas and give free healthcare and free access. I still take Medicaids, really work with anybody. I've always had this model of, in order to get, you have to give. And the give model for me has been working from the second I started to where we are now. And that's how I built this practice. A lot of that is still applicable today, but if everything was smashed and I had to start over again, that would be my number three.
Oh, I love it. Great answers. Well, I want to wrap things up with a final question for you. If you could leave one message for the next generation, what would it be and why would that matter?
The message for me would be to explore everything. You don't know what you don't know. And so many things are, and it's not to say that what's vanilla from one person to another, what does that truly mean? Again, I have a friend that I love dearly who hates mushrooms. And I say all the time, well, maybe you just hated that mushroom. Why don't you try the other mushrooms? Or maybe you didn't like that mushroom the way that was prepared, but maybe in a different sauce you would like it. You don't know. And this is all about exploration. I think you first need to figure out how to be comfortable in your own skin to then allow people to explore. And that exploration brings you down a path, and it may have backdoor play involved. It may not. It may just have analingus and external stimulation. It may have just prostate, whatever that is. And it doesn't even need to have what I do. But I think to allow people to explore. And when you see the younger generation that is so fluid, it's very interesting because when my kids are like, I really think I'm straight, are you okay with that? And I'm like, yeah. Like, we're so sorry we're not gay. And I'm like, no, you don't need, that's all good. I said, you may think you're one thing one day, and then years later, you may decide that you're not, or that you are expanding. And what does that mean? Limitations suck. I try to implore on my kids and my clients and students and all this is that there should be no limits, right? There should be no preconceived notions. There should be no, oh, I am this thing. It's like, well, maybe you think you're that thing, or maybe you are that thing now, but who knows what you are in 5 years, in 10 years. And I think we all look back. The thing that I know being 50 is I don't know as much as I thought I knew. There's so many things that if people say that they know, I'm like, that's fucking bullshit. You don't know because I don't know. That would be my mainstay, is just open to all things in life, and especially sexually.
Yeah, I love that you said that because the older I get, the more I question things. I
Of
feel like in
course.
my 20s, I knew everything. I was the smartest
Absolutely.
person walking around. And now I'm getting older and older, and I'm like, oh, I don't know as much as I thought I did.
Yeah, totally, totally. But I think that that comes with time and being wise. And how do you kind of push that towards everybody? Because I think if everybody engaged in backdoor play, the world would be a better place. Just like I think if everybody would smoke a little bit of weed and just chill the fuck out, I think things would just wind up working out a lot more. Now we're comparing all of those things, but I think it's just the world is so crazy. Why not engage in backdoor play, right?
I love it. That is our perfect final message for this. The world is so crazy. Why not engage in backdoor play? All right. So I want to end this real quick, letting people know where they can get your book and if you have any projects or anything coming up over the next year.
Yeah, thank you so much. So, But Seriously, it has its own URL. You get on Amazon, all the book places all over the world. So, thank you so much for supporting that. Projects, I mean, always projects happening. Some things I can't tell, some things I could tell, but pushing the narrative, I think, is number one. Obviously, continuing doing what we're doing. Check out all the social stuff. It's The Future Method, which is the brand product side stuff, which is expanding into a lot of cool things this year. Myself, DR, Evan Goldstein on all the social stuff, and then Bespoke Surgical, the clinic itself that provides this amazing care. So all those things are at your disposal. And then anything that anyone ever needs, DM, Insta, whatever, email me. I'm more than happy to help anybody.
Oh, fabulous. Well, thank you so much for being with us today.
Well, thanks again.